Everyone. Today I'm going to discuss a topic about provisional restoration in fixed partial tension. These are the contents, definition, requirements, classifications, applications. Introduction. The word provisional means established for the time being, pending a permanent arrangement. A interim process is other name for provisional restoration. A fixed or removable dental process is designed to enhance aesthetic stabilization and a function for a limited period of time, after which it is to be replaced by definitive dental processes. Requirements of provisional materials. It should be biologically uh, needed. Pulp protection, periodontal health, occlusal compatibility, prevention of fracture. In mechanical, greater stresses in interim restoration occur during to reduce the risk of failures. It will be aesthetically very pleasing if it uses temporary restorations or a provisional restoration. Aesthetic concerns, incisor canines and premolar uses a guide for optimum aesthetics in definitive restoration. It is shaped and modified until its appearance is mutually acceptable and to the dentist and the patient. These are the five classifications: method of fabrication, prefabricated, custom made, technique involved in fabrication, direct, indirect, and indirect direct technique. Location of fabrication, chassis, laboratory. Duration of use, short term, medium term, long term. Types of material used: metal provisional restoration, aluminum, nickel, chromium, tin, silver. Resin based provisional restoration, cellulose acetate, polycarbonate resin, PMMA, PEMA, UDMA. Methods of fabrication: prefabricated, custom made. Prefabricated crowns, two shaped of various materials. It will be prefabricated. Most crown form needs modification. Example: axial reconductoring, occlusal adjustment and relining. They can be cemented directly onto the prepared teeth. Available in various tooth sizes and shapes. Metal, due to their appearance, they are used to posterior regions of mouth. Various type of metal crowns are available: aluminum, stainless steel, and tin silver, nickel, chromium alloy crowns. Aluminum crown forms, these have been used for many years as the material is easy to manipulate and it is malleable and definite. Nickel chromium alloy used in children with extensively damaged pyramid teeth extensively. They cannot be altered with resin. These crowns can be easily recounted using pliers. Custom made crowns. It will be custom made. Uh, Represent one of the best choice for provisional restorative treatment. This technique allows for intimate contact between a provisional restoration and a prepared teeth. Tissue surface form, direct and indirect forms. The third category, indirect direct, results from the sequential application of these two forms. Techniques involved in fabrication: three techniques: direct, indirect, and indirect direct. Direct technique: the prepared teeth and tissue directly provide the tissue from the provisional restoration. Uh, this it will be the teeth and tissue will provide tissue teeth for provisional restoration. Uh, Techniques available are shells, matrices, and direct syringing. Indirect technique: impression of the prepared teeth will be taken, and after that it will be technique will be used. Avoid exposing patient to adverse properties of resins. Optimize the properties of resins. Ease of making significant changes in contour or occlusal changes. Materials: PMMA, PMA, and polyvinyl methacrylate, vinyl ethyl methacrylate, butyl methyl acrylate, visible light cure, UDMA. Presently available provisional luting cements are polycarboxylate temporary luting cement, low post-operative sensitivity, adequate retention, easy cleanup. ZOE temporary luting cement, sedative on sensitive teeth, excellent antibacterial effect. Example: Rexel temp bond, flow temp, high bond, ZOE, Shofu dental. Provisional restoration for implants. Challenging roadblocks to implant treatment is the patient perception for the of the temporization. Partially hidden site, fully hidden site. Fully hidden site, we can use CD, complete dentures. Uh, Partially hidden site, fixed processes. Example: existing FPD, acrylic provisional resin bonded bridge. Removable processes, staple flippers. Example: A6 plates can be used. Zone temporary luting cements replace eugenol with various type of carboxylic acids. Uh, Compatible with permanent resin cements, greater retention than ZOE cements. No sedative effect on pulp. Example: Raleigh X Tamponi, Tempon, and Freeginol, Nozinol, And temp advantage, fabrication in office bonded bridge. It will look like this. Fabrication on a S6 appliance with a fixed S6. We are preparing a temporary restoration and it can be inserted in a space mode. In conclusion, although interim restoration are usually intended for short-term use and then discarded, they can be made to provide pleasing aesthetics and adequate support and good protection for teeth while maintaining periodontal health. They may be in dental office by number of practical methods from several commercially available materials. Uh, the success of a fixed prosthodontics often depends on the care with which the interim restoration is designed and fabricated. So these are the contents about the provisional restoration. Thank you.